Here we go. Welcome, everybody, to another episode of The Big Idea. I'm your host, Dr. Jeffrey Hanna, where we talk about the big idea, how it is that a little bone at the base of your head can have a profound impact on your health, well-being, and can change the quality of your life. We're going to be talking today about what's known as lumbar stenosis. In other words, narrowing of the spinal canal in the low back that can produce a lot of low back pain, sciatica, areas that we never think are actually associated with the neck. And I'm going to show you a couple of very interesting research articles, also a couple of x-rays to illustrate for you how exactly it is that a problem in the neck can actually be causing issues elsewhere. In other words, low back pain can oftentimes be a neck problem in disguise. Let's get to it. All right, first up, a bit of an overview. We go through life as human beings experiencing any number of different physical injuries, slips, trips, falls, from the time that we're born to the time when we are little kids, young adults, and even into being grown adults. And the thing about it is, oftentimes when we have these injuries, we don't have broken bones, bruising, or even bleeding, but that doesn't mean that there can't be damage on the inside. And in particular, whether it's a head injury, a neck injury, or even a tailbone injury, it causes a whiplash effect to the body, and our neck is the weak link in the chain. And the caveat here is, as I'll show you right here, is if you've got an injury that produces a tiny little slip in the structure of the neck, what this can do is it can lock into an abnormal position, and even only by a millimeter or two, that amount of stress creates tension in your muscles, ligaments, and nerves that can add up over a long period of time. Now, your brain is not stupid, and it's going to try to find intelligent ways for your body to be able to compensate for this. So very commonly, what we see are posture distortions. A person's posture has nothing to do with being lazy. It's a reflection of where the stress and tension is beneath the surface. The caveat is if you've got these abnormalities going on for months, years, or even decades, it means that there's stress in your body that's affecting those muscles, those joints, those ligaments in ways that they were never designed for. And as a consequence, depending on where it is that we hold our stress, that is the area that's most likely going to be affected, whether it's our head, whether it's our neck, whether it's our hands, whether it's our low back, whether it's our hips, our knees, or even our ankles. So the point of what we do, this thing called upper cervical chiropractic care, this is a special division of chiropractic that focuses on the healthy alignment, the function of those upper vertebrae in the neck without twisting, cracking, spinal manipulation. If you can give the body even that little bit of what it actually needs and remove that source of interference, by taking that pressure away, it gives your body the opportunity to do what it's designed to do. That is heal itself. And as the head comes back over the shoulders, and as that tension comes out of those muscles, ligaments, nerves, we actually see full body changes occurring. And this is going to be a very important concept, especially as we're talking about this lumbar stenosis. Yes, we are absolutely talking about a mechanical and a neurological issue that's going on in the lower back. Nevertheless, there can be more going on than meets the eye, and where the pain is not always where the problem is coming from in the first place. Okay, so let's talk a little bit here about how it is that the neck can be affecting the low back here. And this is actually kind of interesting because I was doing a bit of online research, and I came across two articles that just sort of glanced over this subject on the exact same day from two very different authors, one published in Europe, the other published from researchers in Japan. And both of them, they make this interesting link between what's going on in a person's neck and what's going on in their low back. Now, both of these research articles, they're referring to surgery, but how nice would it be is if we're able to address and look at these things naturally. So we'll have a look at these a couple of papers here, but then we'll talk about what a few more of the more conservative options may be and how it is, again, that addressing the neck may be able to help things out here. Now, first up, which I probably mentioned, is that when you're dealing with a genuine stenosis, I want you to think of a balloon with a piece of string attached to it. This is essentially your brain and your spinal cord. And that piece of string is attached up at the top of the head, the C1, the C2, and the C3 vertebrae. And then it's relatively speaking freely floating all the way until it gets down to your tailbone. What a lot of times people don't realize is that your spinal cord does not actually go all the way to the bottom. It actually ends somewhere in the middle or the small of your lower back. And from that point, as it goes down through your lumbar spine, it's actually a series of free-floating nerves. And what this suggests oftentimes is that when we have narrowing or disc issues, things like that going on in the lower back, that the source of the pain is not necessarily coming from the low back, but what it is it's something that's creating tension in that string, in that spinal cord itself. But because the nerve is essentially the conduit of that information, our brain perceives it as if it's coming from the periphery, from our leg, from our sacroiliac joint, from our hips, or from our lower back. Imagine that piece of string, if you would, that I've got it holding in my hands like this. It's normally going to have a bit of flexibility like that. Well, if I tug that string from the top, well, guess what? The tension is going to be down at the bottom. So first and foremost, this is an important distinction to make, is that most people are going to have a certain amount of mechanical damage in their low back. Disc injuries, degenerative arthritis. Why is that? Because we're human beings. We walk upright, we twist, we bend, we do all different kinds of things like that. But we know from the research that 85% of people who have bulging discs, who have degenerative arthritis, they don't experience any pain whatsoever. This suggests then that there's some kind of other factor that has to be in play. So just because we have pain in a certain area, that doesn't necessarily mean that's where the problem's coming from. So I want you to keep that string analogy in mind. That will explain to you a little bit more about how it is that the net can be affecting what you are feeling down in your low back. Now, a stenosis. A stenosis is a condition that can be diagnosed from a CT scan or also from an MRI, where we can see into the vertebral canal itself. And what we see is a narrowing. In other words, there is not as much room for all of the structures that should be present there. But you remember what we talked about ever so briefly. Your spinal cord actually ends at the level of about the L2 vertebra. And most of the time, where people do experience stenosis, disc damage, degenerative arthritis, that's actually occurring below where the cord ends. And yes, that narrowing, that arthritis, that bulging, it can affect the nerve roots as they are exiting the spine and going to the different tissues, organs, various cells, muscles, ligaments of the body being a source of pain, especially if you see a discompression. But oftentimes that can be a bit of a red herring. And the reason for that is because if you have an upstream source of tension, what that does is that decreases the margin of error, meaning it's more likely for a person to experience pain or discomfort in these areas. As a good example of this, there's a number of people who they go to massage therapists, they go to chiropractor, they go to physical therapy, and all of the treatment is focusing on the low back because they're experiencing low back pain. And for those individuals who get relief with these procedures, beautiful, brilliant, that was able to solve it. There's nevertheless a significant percent of the population who don't experience any benefit, even though they're focusing and doing, in all honesty, all of the right things in the low back. It's for those people in particular. You're doing all the right things, you're having the treatment for the low back, but you're not getting any benefit. That should be a telltale sign that very likely the source of your pain and discomfort is coming from somewhere else. So let's have a look at some of the research that we have here. Number one, the prevalence of asymptomatic cervical spinal cord compression in individuals presenting with symptomatic lumbar spinal stenosis. what these particular researchers did is they said, okay, we want to see a bunch of people who, or we're going to do a literature search and we see what percent of people who have diagnosed lumbar stenosis simultaneously actually have an issue where there was a narrowing, constriction, and irritation of the spinal cord up in the neck. But the interesting thing here that's worth highlighting is that these people were asymptomatic in the neck. The neck felt fine, but it was their low back where they were experiencing the pain or the problems. And what they found, asymptomatic cervical spinal canal compression appears to occur in a high number of patients, with this study noting its presence in 1/3 of patients with lumbar spinal stenosis. In other words, 1/3 of the people who have lumbar stenosis, at the exact same time they have stenosis in their neck, but they're not even aware of it because they are not experiencing any pain or symptoms in that particular area. And that was the first study that I came across. The second one is this one right here. Low back pain improvement after cervical laminoplasty in patients without tandem lumbar stenosis. This was a procedure that was done with surgery. In brief, what they did is they had people who were experiencing low back, but what they did was they removed part of the bone. In other words, they made the neural canal in the neck a little bit wider. And they wanted to see, okay, well, what could actually happen for these people? Were they going to be experiencing any issues with improvements of their low back? And what they did is they did basically a retrospective study of, and this is the important thing, 56 consecutive patients. So it wasn't just 56 of, oh, we're going to cherry pick the best of the best cases that support our hypothesis. This is 56 consecutive people. And their conclusion, based on this research, was that the low back pain improved after doing a procedure in the neck. In other words, this is supporting that idea that there's a significant percent of the people that if you are going to look and if you're going to try to resolve a low back pain kind of condition, look to the neck, because that could actually well be the source of the irritation in the first place because of that string tension. Now, I want to show you how even on a very simple x-ray, not of the low back, but of the neck, we can see signs if there is going to be infiltration or tension occurring of your spinal cord. Now, on an x-ray, we can't see the soft tissue structures. What we see are the bony tissues. But we know that if we ever see distortions, displacements of the cervical vertebra, we know because those vertebrae anchor onto the neural tissue itself, that that's going to be producing tension. In other words, where you see the bone and the joints go, we know that there's going to be irritation of the nerves, the blood vessels in that particular area. And what we can do very, very simply, if I'm even using my little mouse cursor right here, what are we looking at? We're looking at the head right here, face and the teeth are over here, and then this is the overall curve of a person's neck. Now, what we should see is we should see a nice, smooth, reversed C-shaped curve, something kind of like this. Forgive my poor artistic merit here. But what we see in this particular person is we're seeing that, okay, it starts out pretty good, but then bang, there is this hard kink, and in truth, the neck is actually way, way, way too straight, with all of the stress and the tension occurring right through this particular area between the C2 and between the C3. And oftentimes people are told, oh, you just have, degenerative arthritis going on in your neck. That's normal. That is not normal. Degenerative arthritis has nothing to do with getting older. It is not a normal process. It's the consequence of a physical injury that didn't necessarily break, didn't necessarily bleed, but it caused damage on the inside. And the body has been laying down little bits of additional calcium to support it, like rust. Think, if you would, of a bike that's been left to rust out in the rain for a few months, few years, or a few decades. That's what degenerative arthritis is. It's not because of the age of the bite, and arthritis is not because of the age of the individual. It's the age of the injury that was never resolved in the first place. We see some people who are 80 years old and they have almost nothing wrong with their bone density, with degenerative arthritis, and yet we also see people who are in their early 20s and their neck already is riddled with arthritis. Well, how might that happen? Well, birth injuries, learning to ride bikes, learning to drive cars, and then add on top of that, being stuck in front of screens, mobile phones, all of our different devices, part of modern society. All of that produces additional stress and strain and can cause our joints to wear down prematurely because of the accumulative physical stress. Nevertheless, I'm going to point out a couple of things here. I've already shown you the overall curve of the neck and how we can look at an x-ray, and even if we're not seeing observable forms of pathology, we can still look at that and say, well, that ain't right. What we can do is we can actually do a few very, very basic lines. And even if you've never studied radiology, you'll be able to follow this along with me. We start at the tip of the C2 vertebra like this, and we start drawing a line down, something like that. And we see that there's a little bit of a step. And what I'm doing is I'm basically trying to outline the backs of the vertebral bodies right through here. You can ignore that little bump right there. That was just because of my mouse cursor right here. You may also be able to notice that we have these little white spots right through these white little lines. Those represent the back part of the bone. It's called the lamina, and this is where the back part of the spinal cord will sit. And same thing, if we're drawing a line like this, what we should see is a nice smooth line going from one vertebra all the way down to the others. Now this was not a mistake right here. I'm going to take that away. And you might be able to trace and see this with your own eyes. We're following the relative contour and the pattern of those white lines there. But then we see this step right there, in particular between the C2 and the C3, which interestingly is also the exact same spot where we see that step occurring from the back of the vertebral bodies. And what this suggests is it suggests that the vertebra has actually shifted backward like this, which means in the neck, there is narrowing of the opening that's occurring for where the spinal cord boundaries being right here. Your brain, located right up through here, should travel down through this open space here all the way to your low back. And when we have narrowing occurring in the neck, because something is not sitting, something is not moving right, that can be the source of tension. And this is what we are referring to when we talk about a cervical canal stenosis. And this is what those Japanese researchers were finding. What they did, they went a little bit farther when we would do in a chiropractic setting. They said, okay, what we're going to do is we're going to do surgery and we are going to cut off the back parts of the bone right through here. The idea being is if you cut that part off, then suddenly there is more space for the spinal cord to actually sit. And that's a pretty invasive procedure. Don't misunderstand me. There's a time and a place for surgery and all things in medicine. But how much better would it be, using this person as an example, is if we're able to identify, something is not sitting right at that C2 on the C3 vertebra. Are we then able to do something where we can help improve the mobility through that area without surgery and without even twisting or cracking, to where you can help restore the normal motion? If you can give the natural wisdom of your body even a millimeter or two worth of give, even if you can't undo the degenerative arthritis, that oftentimes is enough for your body to say essentially, thank you. We can work with that. And it's not perfect, but if you can take even a little bit of that tension out of that string and increase that flexibility, even if there is stenosis down through the low back, even if there is disc bulge, even if there is arthritis in the low back, the body can say, good chunk of the time, we can work with that. And as a result, people can actually experience these different kinds of symptoms and the issues that they don't actually associate with their neck. But I've got one more image for you right here. And this is actually of a child. This child here would have been about 10 years old, and they were having all kinds of different neurological issues. I don't like taking diagnostic images of kids, but there's a time and a place when it's like, okay, something's going on, and this child is slipping between all the cracks. We need to look and see what is actually going on the inside. And yes, granted, they were moving their mouth just a wee little bit when we were taking that picture there. But what I want to showcase for you right here is a very commonly underdiagnosed problem and another potential source of that stenosis coming from the joints in the upper neck. On the previous x-ray, you could see where there was that distortion occurring between the C2 and between the C3. But what is often missed in terms of a lot of diagnosis that's out there is where you have issues between the skull and between the C1 vertebra. And it's not necessarily to the point where the joint is dislocated or unstable. No. We're not talking about that. But again, an offset. And especially then if it's a child, as the twig is bent, so grows the tree. The body finds, again, intelligent and wise ways to adapt for stresses. But it can only adapt for so long before it starts to show up in a lot of different ways. And in kids particularly, this can show up in their neurodevelopment. This can show up in headaches. This can show up in migraines. This can show up in terms of their mood. This can show up in terms of their eyes. It can show up in terms of the way that they are learning and behaving to become a functional human being. So let me show you what we've got here. All right, so same thing. What I'm going to do is I'm going to draw a line along the back of these vertebrae here. And you might remember I said earlier that the curve of a person's neck should be a reverse C-shaped. This is actually S-shaped. S-shaped is the hallmark of a whiplash injury. It does not have to be caused by a car accident. It's anything where the head suddenly jerks one way or suddenly the opposite way. And what happens is you can have damage and distortion on the inside. And it's oftentimes, it's just a soft tissue injury. It'll heal on its own. Yes, it will heal on its own. But that doesn't necessarily mean that it's going to heal the right way. And if it then starts to heal in the wrong position, the wrong orientation, there you go. That again is the source of tension irritation that we can see on the spinal cord, on the string, on the balloon. And this is why even as adults, we oftentimes see issues with concussion, with whiplash that can go on to affect us and cause any number of different chronic pain disorders. And what we also know from the research is that very seldomly, if a person is prone to concussion, is it ever just the one injury. In fact, it's if you have had some kind of a previous injury. There is some kind of mechanical aberrancy going on in the neck before the concussion that lowers the margin of error, meaning it's more likely that a person can experience a concussion if they already have a problem like this going on. So I'll show you here, but I'm actually going to go in the reverse direction. I'm going to start from the base. Again, we're following those little white lines along the back of the spinal canal. And so far, it all looks pretty good until we get to the level between the C1 and the C2. And then it comes up like this. And you can see that there's a very, very big step located right there. In fact, if we were to come to the front of this child's neck here, we always need to be concerned that there are no signs of instability between the C1 and between the C2 vertebra. I did assess this child. I did see that there was no signs of instability. Nevertheless, there are definitely signs of stretch going on. And when you have stretch, it means, again, the body's going to be able to find ways to adapt for these things. Nevertheless, this can set a person up for all kinds of different issues going on later in life. And unfortunately, the way that a lot of different diagnostic images are done, when you're looking to see, okay, is there evidence of a neck injury, they have the tendency to stop right there at the level of C2. And then if you're suspecting a head injury, well, guess what they do? They stop right there, right at the base of the skull. And this vital area, the upper part of the neck, oftentimes goes underdiagnosed, unrecognized for what it actually represents. And I can show you that on this little model that we have right here. What is this? This is a big giant version of the skull. So here would be back of the skull. Down through the hole here then, this represents the spinal canal. That's where your brainstem sits. And then we've got the top vertebra in the neck, and then the second vertebra in the neck. The top one is the one that lets you move your head in all of the different directions. The second one is the big pointy one, and it's supposed to have a big bump. If you're checking your own neck, it's supposed to be that way because that's the major anchor point for every muscle that goes up to your head, down to your shoulders, and then ultimately down to guess where? Your low back. Now, what I want to illustrate for you here is if you were looking down through that opening, such as with those films that I had shown you before, when you start to have mechanical distortions where that vertebra is misaligning, and if you're talking about to the point of pathology, pathology is typically not diagnosed in the upper neck unless you're talking about a displacement of 50% of the joint's normal function. In other words, if you're looking down through the opening right here, 50% would be narrowing like this or like this. And we're not talking about that much, but we're talking nevertheless about distortions like that that create a narrowing through here. And maybe not to the point or degree where the spinal cord is getting compressed or crushed, absolutely not. But nevertheless, because of the ligaments we know on the inside, they are creating tension. And they're creating tension on the nerves, on the cord, that produces an basically aberrant function that adds up over a period of time, like continuously tapping a bruise. And what did we show you all the way back in the beginning? If you have a continual source of irritation, your brain is going to say, we don't like that, but we can't do anything about this. Sorry, body, we need you to take one for the team. And that's what's going to start to produce the posture distortions that lead to abnormal stress and tension through the bones, through the muscles, through the ligaments, and ultimately through the nerves and other parts of the body. And the low back, especially because it's the major weight-bearing structure, that is one of the biggest areas that's going to have to absorb that tension, which is one of the reasons, again, why we so commonly see degenerative arthritis showing up in that area. But this is the important thing to understand then. In that particular circumstance, the low back issue was not what started the problem in the first place. It was part of the compensation. But it's been compensating for so long, there eventually comes that point in time where the body, as strong and resilient as it is, says, we can't do this anymore. And then seemingly out of the blue on one day, you're just bending, you're twisting it the wrong way, and bang, there it goes. And that's when we find the arthritis and the disc damage and the stenosis. But again, that was not necessarily what the primary cause was. And if that's the case, we can treat the area, we can give a certain amount of palliative relief. But if the primary issue is actually happening upstream, in order for there to be a true long-term resolution, we can't just be addressing the symptom. We have to address what the underlying cause is. Now, to wrap this up here, again, there's absolutely going to be a time and a place where we need to be treating, we need to be adjusting the low back, we need to do physical therapy for the low back. And if things ever get to the point where things are just completely cactus, yes, there is a time and place for surgery as well. Nevertheless, and all of the best surgeons will agree with this, they would want you to they would want you to do every conservative option first. And if all of that, even after all of that, you're still not getting a breakthrough, then yes, that is when surgery is appropriate. It should not be the first line of defense. But also what it means is it means that not just exhausting all of the options for treating the low back, it means exhausting all the options treating the spine as a whole. Recognizing then that there can be a significant percent potentially up to a third of all the lower back and all the lumbar stenosis conditions that may actually be a neck problem in disguise. And this then, in particular, is where an upper cervical chiropractor may be the best person to be able to help break that cycle and help you get that resolution you're looking for. So thank you everybody for watching this. If you've enjoyed this video, please do click that like and subscribe button and go to my personal website, which is drjeffreyhanna.com, where we have all kinds of other videos, blog articles on a number of different conditions related to the neck. We'd also ask you then, please share this video if you've got friend, family member, coworker, whoever it would be who you think would benefit from this. And if we've identified something and you want to reach out to find out how we can help you, go to our practice website, which is clearchirospokane.com, or give us a ring at 509-315-8166. We'll be happy to help you out. Thanks again for watching. So till next time, take care. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.